Hello and welcome. Today we're diving deep into a serious eye infection called bacterial keratitis. This condition, if left untreated, can threaten your vision. So, let's understand what it is, how it happens, and what we can do about it. Bacterial keratitis is primarily caused by bacteria invading the cornea, the clear front part of your eye. This usually happens when the cornea's protective barrier is compromised. The most common culprit is contact lens wear, especially when lenses are improperly cleaned, disinfected, or worn overnight. Other causes include eye injuries, such as scratches or abrasions, allowing bacteria to enter. Pre-existing eye conditions like dry eye or corneal dystrophies can also increase the risk. Even contaminated eye drops or topical medications can introduce bacteria and lead to infection. Basically, anything that breaks down the corneal surface creates an opportunity for bacteria to invade. Now, let's talk about what actually happens in the eye. When bacteria breach the cornea, they release toxins and enzymes that damage the corneal tissue. This triggers an inflammatory response, with immune cells rushing to the site to fight the infection. While these immune cells are crucial for defense, their activity can further contribute to corneal damage. This inflammatory cascade results in corneal ulceration, swelling, and the characteristic clouding seen in bacterial keratitis. Over time, without treatment, this process can lead to scarring, thinning of the cornea, and even perforation, where a hole forms in the cornea. Bacterial keratitis affects people of all ages, but certain groups are at higher risk. Contact lens wearers, particularly those with poor hygiene practices, are a significant percentage of cases. Individuals with weakened immune systems, perhaps due to diabetes, or immunosuppressant medications, are also more susceptible. People working in environments with a higher risk of eye injury, such as construction or agriculture, face an increased risk too. Geographically, areas with warmer climates and higher rates of eye trauma may see a higher prevalence of bacterial keratitis. The symptoms of bacterial keratitis can be quite alarming and usually appear rapidly. Expect to experience severe eye pain, often described as a constant throbbing or burning sensation. Redness of the eye is also a common symptom, as is excessive tearing or discharge. Blurred vision or decreased vision are hallmarks, and sensitivity to light, known as photophobia, can make it difficult to be in bright environments. You might also feel like something is in your eye, a sensation called a foreign body sensation. It's crucial to seek immediate medical attention if you experience these symptoms, as early diagnosis and treatment are vital. Diagnosing bacterial keratitis involves a thorough eye examination by an eye care professional. The doctor will use a slit lamp, a special microscope, to examine the cornea closely, looking for signs of ulceration, clouding, and inflammation. A corneal scraping is often performed, where a small sample of corneal tissue is collected and sent to a laboratory for analysis. This helps identify the specific bacteria causing the infection. Additional tests might include cultures and sensitivity testing to determine the most effective antibiotics to use. A detailed medical history is also taken to identify any risk factors, such as contact lens wear or previous eye injuries. While we don't generally classify bacterial keratitis into different types, in the same way as some other diseases, it's important to consider the severity and location of the infection. A small, superficial ulcer might be considered less severe than a large, deep ulcer that threatens the center of the cornea. Similarly, infections caused by particularly aggressive bacteria may require more intensive treatment. These factors influence the treatment approach and the overall prognosis. The primary goal of treatment is to eradicate the bacterial infection and prevent further corneal damage. Treatment typically involves frequent application of topical antibiotic eye drops, often every hour around the clock in severe cases. In some instances, oral antibiotics may also be prescribed. Pain management is crucial and may involve over-the-counter pain relievers or prescription medications. In severe cases, a corneal transplant, also known as a penetrating keratoplasty, may be necessary to restore vision if the cornea is severely damaged. Follow-up appointments with your eye doctor are essential to monitor your progress and adjust treatment as needed. Prevention is always better than cure. For contact lens wearers, meticulous hygiene is key. Always wash your hands thoroughly before handling your lenses. Clean and disinfect your lenses daily using the recommended solutions. Avoid wearing your lenses overnight unless specifically prescribed by your doctor. Replace your lens case regularly, and never use tap water to rinse your lenses. If you experience any eye irritation or redness, remove your lenses immediately and consult your eye doctor. For everyone, protect your eyes from injury by wearing appropriate eye protection during activities with a risk of eye trauma. If you have dry eye or other corneal conditions, follow your doctor's recommendations for managing these conditions. The prognosis for bacterial keratitis depends on several factors, including the severity of the infection, the promptness of treatment, and the specific bacteria involved. With early and appropriate treatment, most people recover with good vision. However, delayed or inadequate treatment can lead to serious complications, such as corneal scarring, vision loss, or even the need for a corneal transplant. Recent research has focused on developing new and more effective antibiotics to combat resistant bacteria. There is also ongoing research into advanced diagnostic techniques that can rapidly identify the specific bacteria causing the infection, allowing for more targeted treatment. Furthermore, newer treatment modalities, such as cross-linking, are being explored as adjunctive therapies to strengthen the cornea and promote healing.